It says live. I think it's working, which is
Okay,
good.
good. Good, good, good.
Hello, Quana. It's so great to have you.
Hi, McKenzie.
Yeah, I'm so excited that we got to figure this out and
Yes.
make it happen. And I really hope that we're streaming live right now. Unclear. If not, this is going to be recorded
Right.
and people will enjoy it later.
You'll get the information regardless.
Yes, exactly, exactly. Well, awesome. So today is all about navigating constipation in pregnancy and postpartum. I've got some slides for us, and I'm excited. And hopefully, people can ask questions.
I know, yeah. Hopefully we can get some questions asked.
Um, and we will see if that is. Hello, people. I'm typing in the chat. Ask questions here. Um, but if not, that's okay. We absolutely love engaging with people on social media, and
Yes.
once this is posted, it's going to be up on YouTube, etc. Please do feel free to ask us questions there if nobody can hear us right now or can't ask. Technology, we'll figure it out.
Right. It's always changing.
Yeah, awesome. So I'm going to jump into our slides and
Yes.
have you introduce yourself, Kwame. Let's get here. Okay, take it away.
All right, so hello everyone. Welcome to our talk today as Mackenzie and I discuss navigating constipation during the pregnancy and postpartum period. So first off, I want to introduce myself. My name is Dr. Quana Tribble Jackson, but I go by Dr. Q. I am the owner of PT for Her Pelvic Health and Wellness. This is a clinic that is dedicated to pelvic floor therapy. I am first and foremost a physical therapist, so that's what I studied in college, and I achieved my doctorate degree from Emory University. Emory University, way back in 2011. Time is definitely going very fast.
Mm-hmm.
Um, my practice primarily focuses on supporting women through pregnancy, postpartum recovery, and perimenopause period. I've been open for 4 years. This March 16th made four
Awesome.
years. That is so crazy. Yes. So in these last 4 years, I focused on treating various pelvic floor issues, often stemming from these lifestyle changes that life stages, sorry, that I mentioned above: pregnancy, postpartum, and perimenopause. This does include, but it's not limited to urinary incontinence, pelvic pain, pelvic organ prolapse, and low back or hip discomfort, as well as constipation, what we're going to be talking about today. Outside of work, I am married and I have two biological sons that I birthed myself, and I have two bonus daughters. In my free time, I prioritize self care. That is so important. If you're a patient of mine, you know how much I talk about that during treatment. I enjoy making memories with family and spending time with my friends.
Love that. Yay. And I'm so glad we got to connect. I know we met at a Mind Body Baby event like years ago and then
Years
ran into each other.
ago,
Yeah,
yeah.
ran into each other at a launch party for the Ziva postpartum retreat. And so you're such a great resource to have in Charlotte. But I guess I'll introduce myself as well.
Yes.
My name is Mackenzie Caldwell. I am a registered dietitian, nutritionist. And have been in practice for about 6 years now. And I started my private practice right out of grad school while also working part time at an eating disorder clinic. And the practice is called Feed Your Zest Nutrition and Wellness. We help folks heal from perfectionism around food and their bodies so they can live fully nourished through fertility, pregnancy, and beyond. So we are really, really passionate about helping people have a healthy relationship with food and their bodies during their reproductive health journeys, and absolutely love and nerd out about providing evidence-based body positive nutrition counseling and medical nutrition therapy for folks with reproductive health conditions like PCOS, endometriosis, gestational diabetes, infertility, lactation concerns, and more. And discovering the world of pelvic floor PT was
Yeah.
so awesome for me as a dietitian. I think just period, knowing that I have these amazing colleagues that exist that specialize in the pelvic floor, which, you know, there's absolutely stuff we can do for digestion and constipation with
Mhm.
nutrition. But sometimes our expertise ends, and that's
Mhm.
where PT can be so awesome in supporting our patients. So love that. Um, I also live in Charlotte, North Carolina, and I have no biological children. I would love children at some point, but currently my son is my dog Charlie. He's 11 years old. He's a Boston Terrier mix, and I love him very much. And in my free time, I really like walking him and hang out with him, as well as hiking, yoga, baking, and the occasional adult ballet class when I can make it,
Love that.
which is
Love
so fun.
that.
So
Love that.
awesome. Let's jump into our slides that we
Mhm.
have, our topics that we want to talk about. And the first being the connection between nutrition and pelvic floor. So go ahead and take it away,
Yes,
Quana.
yes, yes, yes. So first, I wanted to talk about the importance of nutrition and pelvic floor health. So as Mackenzie talked about earlier, what we eat directly can affect your gut health, hydration levels, and bowel movement. So we would like to have a diet that is rich in fiber to help promote regular bowel movements and also to help prevent constipation. Constipation can be a major contributor to pelvic floor dysfunction, more so because it can cause a lot of tightness around those pelvic floor muscles. We also want to make sure that we have proper hydration. That is also very essential to our pelvic floor, not only I'm sorry, to our diet, because we need hydration for tissue health, right? And pelvic floor muscles are tissues, right? So dehydration can also lead to harder stools and which can ultimately lead to straining during those bowel movements. So if you think about if we're not properly hydrated, right, it can take our food that we digest a longer time to go through our digestive system because our body is like in slow motion trying to get out as
Mm-hmm.
much hydration as we need. So usually when it is time to have a bowel movement, it's hard. And we've all been there before where you're trying to have a bowel movement and it's hard to come out. That can be very uncomfortable, right? So, making sure that we have a good diet that is rich in fiber and also hydration, just to name a few things, obviously, Mackenzie will jump into that a little more in detail, that can help promote great pelvic floor health. Um, Having good pelvic floor muscles is important for maintaining a good bowel movement regimen and toileting habits and preventing constipation. Like I talked about before, we want to make sure those muscles aren't too tight down there. Tight muscles are weak muscles. I have to make sure I
Mm-hmm.
stress that a lot in clinic because a lot of times we equate tight to strong in so many different areas, not even just our pelvic floor. So I like to make sure that I constantly am letting my patients know that tight muscles are essentially weak muscles because they're not able to fully relax and lengthen to give them that ability to fully contract and strengthen. Okay. um I'm sorry, I lost my train of thought. So if these muscles are too tight, weak, or uncoordinated, issues like constipation can occur, incontinence can occur, and pelvic pain can arise. Pelvic floor therapy focuses on improving muscle strength, flexibility, and coordination to support efficient elimination, which I will get into more detail later. And I use a lot of techniques, including manual therapy, biofeedback, muscle strengthening, as well as muscle relaxation. A lot of times we forget that muscle relaxation, especially in regards to constipation issues and having a bowel movement, is very important. Also use exercises, and we'll go over some different exercises later to help restore proper muscle function, helping you to reduce straining and help encourage optimal bowel and bladder habits. For the sake of today's topic with constipation, constipation is a common concern that happens during pregnancy and postpartum due to hormonal changes, increased pressure on the bowels just from the growing uterus, and changes in activity levels, right? When we're getting up into our end of our second and third stage of pregnancy, we're not doing the things that we usually would do, and activity can affect having normal bowel movements as well. So today we'll talk about the different things that we can do to help get relief with constipation. So just some common things that we happen or that I see with pregnancy: progesterone, which increases during pregnancy, can slow down the digestion. Like I said, the growing uterus can put a lot of pressure on the intestines, causing some issues. And sometimes during pregnancy, we have to take iron supplements. That as well can contribute to hard stools. And we also need to increase our water intake. And a lot of times we don't see that a lot with during pregnancy because it can be a matter of just ill. That is disgusting to me, drinking a lot of water,
Yeah.
or just is too much. It's just too much to think of. Maybe you didn't even drink a lot of water before pregnancy, and now your doctor is asking you to drink 100 ounces during pregnancy, and you're like, what in the world? So, going over different techniques to kind of help get that increased hydration. During the postpartum period, healing after birth. Let's say you had a perineal tear, right? That's traumatic. So when it's time to have a bowel movement, that can evoke a lot of fear around pushing out bowels during that time. Also, just changes in your diet during that postpartum period, as well as pain meds. Pain meds, as we know, can also cause constipation to occur as well. So today, Mackenzie and I, like I said, will go in detail over different techniques to kind of help with that.
Yeah, absolutely. Thank you so much for that overview. And there's so much, and I think one other contributor, one other connection between nutrition and pelvic health that is often overlooked is the fact that undernutrition
Hmm.
affects all of the muscles in our
Hmm.
body,
Yes.
including the muscles
Yes.
in our pelvic floor.
Yes.
And so this is a common concern among our patients with eating disorders. And also,
Mhm.
nothing's going to come out if nothing's going in.
Yes.
So
Yes.
just or in irregular eating patterns as well. When like our guts are just very connected to our brains. They like to have habits and routines, and so there's inconsistencies, whether that's intentional or unintentional,
Yes.
um, is absolutely going to contribute to that. So
I'm glad you said that, Mackenzie. That's actually, I talk about diet on my intake form as
mm-hmm.
well. I go into it within my scope of practice,
Yeah,
what are you
of
eating,
course.
things like that, especially with the concerns that my patients may have. And then I decide, like, okay, we probably need to get over to see a specialist because that is very important. Because
Mm-hmm.
I'm trying to decipher between, okay, is this a true diet issue to where we need to make some changes there? Or is it really that your diet is fine, your bowel movements are, grade 4 or 5 on the Bristol stool chart, but you
Mm-hmm.
just cannot properly evacuate them. So let's look and see if that is a musculoskeletal issue, or is it a combination of both? Can we
Yeah.
have some improvement in both areas to give us a better relief?
Right. Exactly. Exactly. And I'm doing the exact same, but kind of on the opposite side of the spectrum.
Yes.
Like,
Yes.
where is your nutrition at? But like, if I've done what I can, maybe we talk about a squatty potty. But like beyond that,
Yes.
that's you need to go to see Dr. Q. Okay, so let's talk a little bit about what fiber actually is. Number one,
Hmm.
so fiber is an indigestible carbohydrate
Hmm.
that is found in a wide variety of different foods that are from plants. So
Hmm.
the only foods in our eating pattern that contain fiber are plant foods, plant-based foods. And there's different types of fiber. There's soluble fiber and insoluble fiber. Ultimately, when it comes to improving constipation, we just want to eat more fiber, period. But if we're going to increase our fiber, we also need to make sure that we're eating enough food, eating consistently throughout the day, and also consuming enough hydration, which I'll talk about next. Because it is entirely possible to overdo fiber, and this is really gross to think about, but fiber can clog the drain if there's too much of it and not enough fluid to get it
Yes.
going. So that's important to think about too. Um, a lot of people, when they think about increasing their fiber, will immediately go to a fiber supplement, and those do have their place, but there's a lot of more simple things that we can do
Hmm.
first. And many people are also thinking about, like, okay, well, what's my gram number per day? And
Hmm.
okay, 25 to 30 grams per day is ideal for the average adult. But truly, it's kind of hard to count grams of fiber when we're focused on adding in food sources first that also contain a lot of other nutrition.
Hmm.
Fruits and vegetables, number one. So,
Hmm.
looking to get 2 to 3 servings of fruit and 3 to 4 servings of vegetables per day is ideal. And sometimes in pregnancy, especially in the first trimester, the veggie part might not really happen. So a lot of my patients do end up needing to rely a little bit more on their fruit intake to up the fiber, and that is totally perfectly fine. We want to focus on what is tolerable and achievable, and satisfying and joyful to add in as much as possible. And if
Yes.
we can sneak in a little veg when the nausea is really hard, maybe that's in a really cold tart smoothie. Maybe we blend in some
Yeah.
frozen cauliflower, which really doesn't have a whole lot of taste, or zucchini. If you can handle spinach, cool, you'll get some iron and folate in there too. But
Yes.
ultimately, wherever we can sneak it in is great. So fruits and vegetables are the best way to increase our fiber, but we also have other sources of fiber, including whole grains, nuts and seeds, and legumes, which includes beans, peas, and lentils. And again, in that first trimester, when things aren't sounding too great, sometimes shooting for whole grain carbs can actually be fairly tolerable. So this might look like a piece of whole wheat toast with peanut butter and a couple of cutie oranges. That would be a great fiber-rich meal that would also have some protein and fat in it. That might go over fairly well for somebody with nausea in the first trimester. This could look like doing some quinoa or farro or brown rice, or maybe we're literally just adding granola to yogurt with berries. That is a great way to increase your fiber as well. And then our seeds, like flax seeds and chia seeds, are great to throw into a cereal bowl, a yogurt bowl, or a smoothie as well to add that in. So to boil it down, fiber is really important because not only does it bulk up our stools, so it helps them to have the shape and the form necessary for those digestive muscles to push it along, but fiber also helps to draw water into the gut. But we do need hydration we need to be hydrated in order for water to then get drawn into the gut to push it along as well. So focusing first on fruits and vegetables is our umbrella overarching goal, but if veggies are hard, it's okay to prioritize your fruits. And then remembering that starchy vegetables like potatoes, sweet potatoes, corn, and our winter squashes like pumpkin, acorn, butternut squash, things like that are great carbs that like often, again, feel really good and satisfying and comforting in pregnancy and oftentimes in early postpartum as well. Those are great to help us get more fiber in along with the yummy, delicious, comforting carbohydrate too. So lots of ways that fiber can help. This is our number one kind of checkbox that we're going to look for in nutrition counseling when it comes to constipation is, are you eating enough fiber?
Do McKenzie, do you find, I know because sometimes obviously I'm pushing, I'm asking, are you eating enough fiber? And sometimes I get a lot of patients that's like, oh yeah, I'm eating a lot of fiber. And then when you go through kind of like their diet, you're like,
Yeah.
Maybe not. Maybe you're not getting in as much fiber as you think you are in your current
Right.
diet.
Yeah, exactly. And so that's where when we think about the number of servings of fruits and vegetables per day is like a great place to start, because that's the best source of fiber in our diets. So one serving of fruit is like a whole piece of fruit, like an apple, a banana, an orange, or about a cup of chopped fruit or berries or grapes or something like that. And then a serving of vegetables is 1 cup raw or half a cup of it if it's cooked. So overall, we're looking for 2 to 3 servings of fruit and 3 to 4 servings of vegetables.
Gotcha.
Most people are not there. I can tell you I have a hard time eating my veggie. I mean, eat fruits I got. The veggie goal is hard. It can be very difficult. And so
I have to remember to include a vegetable in like meals. I'm like, oh crap.
I know.
It's like,
Yeah.
what can I do for vegetable?
Exactly. It can be hard. It can be really hard to do. So I think sometimes people don't understand where the fiber is and the fact that all fruits and all vegetables do contain fiber. But also in order to get enough, we do have to really boost our serving sizes of fruits and vegetables there. And I will say, again, going back to the fiber supplement piece, like if necessary, we can do that, but it is a lot more beneficial for your health and well-being to focus on the food sources of fiber first, because it's also going to come with a lot of other micronutrients, vitamins, minerals, and antioxidants that are going to be really important for long-term well-being, but your pregnancy and postpartum healing too.
Okay.
And then hydration. So Dr. Q mentioned 100 ounces per day. And yeah, 80 to 100 ounces is our goal for pregnancy and for lactation. And that's because your fluid volume is really high in pregnancy. It's doubling. You've got amniotic fluid, your blood volume is drastically increased. There's just more fluid between, it's called interstitial fluid. It's just the fluid that exists between all the cells in your body and different tissues in your body that like lubricate things and keep nutrients and other compounds moving around. But like so the amniotic fluid is a lot too, and your blood volume is a lot. So we do need more water. And your body is going to try and prioritize keeping your blood pressure up and building that amniotic fluid. It doesn't really care that much about your digestion and your kidneys, but we care.
I tell my patients all the time, I was like, you're going to get what's last.
Exactly.
Baby is going to get everything that baby needs, and you end up what is left over.
Right. And that is why, that's one reason why I'm so passionate about maternal nutrition is because like the pregnant person often just kind of gets left by the wayside.
Yeah.
We've seen a really great reduction in our infant mortality rates in the United States, but maternal mortality is behind, especially for Black women.
Definitely.
So
definitely.
you matter.
Yes.
Your nutrition, your hydration matter a lot.
Yes.
But we've kind of touched on this already. There's not a whole lot for us to add here on like why it's important, but hydration, or excuse me, fluid overall just helps push along a stool and get it all the way through the digestive system. That's what it's doing, and that's why it's so important, especially if you're going to increase your fiber. If you increase your fiber but don't have the fluid, it's going to clog the drain, and that's gross. You don't want to clog the drain. But there's lots of ways that we can increase our hydration. Number one, water. If you like water and drinking water isn't too hard for you, let's do that. Different ways work for different people. Sometimes it's like, let's say we have like a big 40-ounce Stanley, and you focus on drinking half of it, or excuse me, drinking one full Stanley cup by lunchtime, and you refill it at lunch, and then you drink the rest by the time you go to bed. That's 80 ounces of water. There you go. You did it. That goal works really well for a lot of people, but there's also some fun apps out there like Water Llama or Plant Nanny that help people a lot with kind of prompting them to drink more. It gives them kind of like a game to follow to drink enough fluid. But what I like to say is that anything that's not caffeinated and not alcoholic does count towards your hydration. The reason for that is that caffeine and alcohol do dehydrate us, and so it's not like drinking a cup of coffee is going to take away your water, but it might not like
Add
it
to
kind
it.
of might exactly, it might cancel itself out a little bit.
We usually say pair it together. You drink a cup of water, drink a cup of coffee, drink a cup of water with
Exactly. Let's double fist our liquids, but like in a healthy way, not like in college.
it. Right. Yes. Yes.
Yeah.
Also, what do you think about like adding fruits? Because when I was pregnant,
Yeah.
it was, oh gosh, it was just hard for me to do it. So I would like add watermelon, cantaloupe, lemon, some limes.
Absolutely.
it,
That's a
make
really
it
fantastic
Fun.
one.
Like, let's
Exactly.
make this water fun if I have to drink it.
Right,
Get a
and that
good
was gonna be
flavor.
my next like tip is like, okay, if water isn't working or you're getting bored of drinking that much water, we can add some fun fruits to give it some flavor. That can work great. You can even add a little bit of a splash of juice. And many times in pregnancy, especially as we're like approaching the summer months, people might start feeling like I'm drinking a lot of water, but I still feel thirsty, or I'm feeling my blood pressure feels off.
Yes.
Super
Yes.
common, and we can totally add some electrolytes to your drink as well. Or even if like you just want a little bit of the flavor, you could do like a quarter of a packet of liquid IV or half a packet or
Right.
whatever.
Right.
Whatever you feel like you need to do, that's going to be helpful. But juice does count. Soup counts.
Okay.
If
Broth
it's
has become a big thing.
yeah,
I've been
yeah. A lot of people do enjoy drinking a cup of broth. Couldn't be me.
Yeah.
So I'm never going to force it on anybody. But if that's something that you like, it can be beneficial. So lots of different ways. Don't be afraid to have fun with your hydration. Sparkling water works as well. And it, especially again in that first trimester when nausea's hitting like
Yes.
real hard, don't be afraid of a little bit of soda here and there, like some Sprite or some ginger ale. That can, one, add to your digestion and also might help you settle your stomach as well. We want most of your hydration to be plain water if possible, but don't be afraid to have a few fun drinks here and there. You do have room for that.
One of my patients, she swore by coconut water.
There you go. That works too.
Yeah, she swore
Yeah.
by coconut water. And also,
Absolutely.
too, just the importance of realizing hydration, or sorry, dehydration can increase your risk for preterm labor. It can increase
Yeah.
your risk for contractions. And we definitely don't want to go down that
Yeah.
field as well. So usually, like if my patients are complaining of like a lot of Braxton Hicks contractions and things, I'm like, well, how's your hydration looking? Like, are you getting enough water in?
Hmm.
Um, Speaking from well, I wasn't dehydrated, but I did have to get hospitalized in my first pregnancy to
Hmm.
stop preterm labor. And what did they give me? Saline, hydration.
Lots of fluid.
So it does, it definitely does work.
It really
So
does.
let's just try to do it at home.
And some people might be wondering how to know if they're hydrated. Like I know I'm just like I held up my mason jar earlier. I just keep refilling this. I have no idea how many I'm drinking per
Yes.
day. I'm just a thirsty girl.
Yeah.
So, and one way, like you can count the ounces, 80 to 100 ounces of
Hmm.
non-caffeinated and non-alcoholic fluid.
Hmm.
You can also just look at the color of pee, your pee.
Yes.
We're just looking for pale yellow. It does
Yeah.
not have to be clear.
Yeah.
But if it's dark yellow, we need to change something.
Yes.
We need some
Yeah.
more fluid for
And
sure.
also too, looking at your stool. Is it hard? Is it
Hmm.
coming out pebbly? Or is it smooth like a sausage or snake? And usually that's a question and I ask my patients, and it's so funny the face they give me when I first, like, how does it look like a sausage or snake? And I think they're like, well, wait, I'm not examining it. Should I be examining it? Yes, you absolutely should be
Yeah.
examining your stool just to see how your diet is. And also too, how many trips are you taking to the bathroom? If you're not taking
Yeah.
that many trips to the bathroom, that's a good indicator that your body is probably holding on to as much hydration as it can as well. So
Yep.
you want to kind of be going to the bathroom. If you're not pregnant, six to eight trips a day.
Hmm.
Pregnancy obviously is a little more because we have other factors such as baby putting a lot of pressure down on the bladder as baby
Hmm.
grows.
Yeah, that's absolutely another great one. And I was just thinking maybe we should share the Bristol stool chart real quick. So let me just like
Yes, I should
show
have had
that
it
really
here.
fast. Um, let's see here. Sorry for the. We're just gonna Google this real quick, guys.
I have it here, but if you
Oh, you
probably
do have
better
it.
look it up, yeah.
Okay, let's just we'll do this. This is a great one from continents.org, Australia.
Love
I
it.
use a lot.
Yes, yes,
So
yes,
this is
yes.
the Bristol stool chart. Do you want to explain this real quick, Connie?
Yes, so with the Bristol stool charts, that lets us know kind of if you are hydrated or not, and that lets us know how to go about with suggestions for your diet. So as you can see, type 1 is hard and pebbly, is just a lot of lumps. We definitely do not want that. That is a clear indicator that we are constipated. Type 2, you can see that it is starting to form, but it's still lumpy, right? So that will let you know that I do still need some more hydration in my diet. Type 3 is pretty good. That's a sausage, but it is some cracks on the surface. So we could benefit from a little hydration. Type 4 would be optimal. It's smooth and soft. That's letting us know that we still had some hydration come out with our stool, letting us know that our body did not need so much. So we're pretty good there with our body. Type 5, we start getting on the loose end. So we start getting into a lot of diarrhea type when we get to type 5, 6, and 7. That's something that we want to look out for too, because maybe we are getting a little bit too much fiber. Maybe we need to kind of slow down on that, or maybe we are taking a little bit too much of the stool softeners, the colace, and all of those things. So typically here we kind of want to aim for that. Type 4 would be ideal, but type 3, type 4 bowel movement on this chart.
Yes. Agreed, 100%. And I will say I have had plenty of patients who have been totally very well hydrated and still
Mhm.
struggled with type 1 stool. So know that it's not all about that.
Yes,
There's a
yes,
lot
yes,
happening
yes,
there, but
yes,
thinking about what we're shooting for,
yes,
this is kind of, we're shooting for that type 4,
yes, yes.
if possible.
And also too, not even just with hydration, just diet alone.
Yep,
What foods?
yep.
It's a good way to know, like, okay, I can't eat a lot of dairy, or I'm gonna have type 1 or type 7 on the Bristol stool charts.
Right, and everybody's different. Like some people
Yes,
might be totally fine with a lot of dairy, other
yes,
people may
not,
not. And
not me.
something that's really interesting is actually a lot of people who might have been lactose intolerant outside of pregnancy reacquire their ability to digest lactose in pregnancy.
That was
Help.
me.
That was you? Is that
Yes.
crazy? It's
Both
wild.
pregnancies is so crazy. I craved cereal with my first, and I craved ice cream with my second. And
It's so funny.
it did not bother me. If I
That's
was to
great.
go and try to drink milk now, yeah, I would probably
Well, I'll let you talk a little bit more about pelvic floor dysfunction. Take it away.
Yes, yes, yes. All right, so pelvic floor dysfunction and constipation. So the pelvic floor muscles play a crucial role in bowel movements by coordinating muscle relaxation and control to allow stool to pass efficiently. So two major functions here. We want to be able to have enough support in those muscles to actually keep us continent, right? We want to make sure that we're not having any leakage on our cells, any fecal incontinence, but we also need those muscles to be able to relax so we can effectively and efficiently have a bowel movement. So, first things first, this is my rectum here. I'll just kind of show that in relation
Stop
to the,
sharing real quick.
yeah, I'll kind of show that in relation to the other pelvic organs and how they sit in our pelvic floor, if you can see that. So, in the front here, we have the bladder. In the middle, we have the vaginal canal here in the uterus going out to the ovaries and fallopian tubes. And back here, we have the rectum. So it's important to also note too, sometimes I have patients who come in and they're complaining of urinary incontinence or urinary leakage, and I'm asking them about their bowel movements, and they're like, that's not why I'm here. But I showed them this model and I showed them how these organs sit in our pelvic floor and how one can contribute to the other. So if we have a lot of fecal in our rectum, that can put a lot of pressure, which can ultimately put a lot of pressure on the bladder, causing some urinary leakage. So it could be that we just need to make sure that you're having bowel movements um, regularly to get rid of the urinary leakage. So all of that kind of connects and go hand in hand. Taking away our bladder in our uterus and just looking at our rectum, we have a puborectalis muscle which wraps around like a sling to help keep us continent. So that muscle's main job is to aid with fecal continence. So if that muscle is too tight, then we can have a hard time having bowel movements. If that muscle is not strong enough, then we're not getting that support and we can have an issue with some leakage. Okay. The external anal sphincter, which wraps around our anus, that is a voluntary muscle um, group that we can voluntarily control. That helps prevent leakage as well. So during pelvic floor therapy sessions, I oftentimes do a lot of rectal exams. I am feeling for the tone with both of these muscles and also the function to see how they are properly coordinated individually as well as together to help keep us continent. On top of that, I'm also looking at your breathing. That is important because we do need to generate a lot of pressure downward in coordination with our pelvic floor muscles to make sure that we're able to properly evacuate just from a coordination issue with our muscles, right? So I'm looking at that as well. A lot of times during labor and delivery, labor and delivery nurses, they'll tell moms, push like you're having a bowel movement. And what I see a lot of times in clinic is a lot of women don't know how to properly push like they're having a bowel movement. So
Mm.
those are things that we go over and what we see to make sure, like, okay, going back to McKenzie's specialty, is this just diet related or are you having a little bit of issues with your muscles functioning together? Okay. Also, too, those pelvic floor muscles need to be able to relax.
Hmm.
Again, I'm feeling for tone. Tone is tight muscles, right? If those muscles are too tight and you don't know and they're not able to relax or you're having difficulty relaxing them, then we can have some issues having a bowel movement. So then we'll go over different issues, different techniques, which I'll touch on a little bit later to get you to a place to where you feel like you're able to have better pelvic awareness, better control of those muscles. Again, going back, looking at your breathing, because good, deep diaphragmatic breathing does also help with being able to relax your pelvic floor muscles as well. And a lot of times it's just education. We really just don't know what we're doing or what we should be doing, and going over how all of those different components come together to help with a good bowel movement can help as well.
Yeah.
Um, yeah. Also making sure you're not straining, right? We
That's what I was
want
gonna
to,
ask about the squatty
yes,
potty.
yes. Squatty potties are amazing. So what squatty potties do, and it's like a step stool. And I
hmm
tell my patients all the time, if you don't have that at home, for instance, my toddler has a step stool that he uses to brush his teeth. I'll grab that. The toilet, I'm sorry, the trash can by the toilet, I'll grab that and turn it on its side and I'll use that.
hmm
What that does is that elevates your knees a little higher than your hips, and it decreases that resistance of that puborectalis angle, putting it at more of a laxity so that your rectum is able to straighten out so that you can easily evacuate. Um, One of my patients put it, she's like, oh my gosh, when I was visiting overseas, the toilets was a lot lower, and even in some countries they still use the squatting method where
Yeah.
you use the bathroom. That is actually better positioning for you to be able to fully empty,
hmm
right? So we do need to be in a position where our knees are slightly higher than our hips to help us have a good bowel movement. And a lot of times in America we don't see toilets that low, um, for various reasons. So we can just make our knees a little bit higher with that. And also not straining. So I also look at that. So if we're doing a lot of straining, meaning that we're generating a lot of pressure in our core, but nothing is happening at our pelvic floor, then that can cause issues like hemorrhoids, right? When we are pushing from our diaphragm, kind of like you're blowing out birthday candles, just creating a little bit of resistance there. Our pelvic floor muscles should respond and they should lengthen at the same time. You don't want to
hmm
push and nothing is happening, right? And you don't want to push and you're contracting at the same time. So getting that coordination there. So I'm looking to see what's happening there and teaching as needed and giving cues from there as well. So that's why we don't recommend, definitely don't recommend straining. But if you feel like you have an issue with having a proper bowel movement, then definitely recommend getting in to see a pelvic floor specialist to see what you can be doing from a musculoskeletal or neuromuscular standpoint. Signs of that could be not feeling like you're completely emptying. It's a
hmm
good sign, like I went to the bathroom, but I don't feel like I completely emptied afterwards. Or I have a lot of hemorrhoids.
hmm
Have hemorrhoids as well. Or it could be an issue of I'm wiping a lot. Like I'm not getting clean on one or two wipes. I'm having to continuously wipe. Then we would kind of want to take a look at those muscles to see what's going on and to see if we can find any type of issues that could be contributing to the constipation from that standpoint.
Yeah. Absolutely. And
Right.
on the squatty potty front, sometimes if it's my one of my patients like first pregnancies, I say like, yeah, you can get a squatty potty, but go ahead and just buy a kiddie
Get
stool.
it.
Like you're
Get
gonna have
it.
a toddler in a year or two.
Why not? Why not?
And
Get
that
the
can,
most bang for your buck,
yeah,
right? And also,
exactly,
too, you just don't want all that stuff in the bathroom, right?
right,
Depending on how, you know. It's
exactly.
funny because I was at a pelvic floor conference a couple years ago, and you'd be surprised at how many pelvic floor therapists had their travel squatty potties,
Oh my
right?
gosh, I did
Which
not
I'm
know that
like,
was a thing. That's awesome.
yes, it is. Because if you think about it, our bowels like routine,
Yeah, they
right?
do.
They love routine. They love to go at a certain time of the day. Moms seem to not have that routine as much as dads because our schedule is usually dependent upon baby and toddler and all of those things. So if we
hmm
can master that routine, that is great. And that's a lot of stuff that I go over with my patients, trying to get a routine, teaching them how to do a bowel massage to
hmm
help with manually pushing that out, especially if we're not getting a lot of hydration. Like, all right, let's do some manual bowel massages to try to empty as well. But when we travel a lot too, that can throw off our routine and also our diet because we're not, usually eating what we normally would eat. And we can get shy bowels too as well. So
Yeah,
having a travel squatty potty is a thing. I was like, of course I would see this at a pelvic floor conference.
yeah, that's awesome, and I might be looking into that for myself.
Myself as well.
I love that. That's great.
Yes.
Yeah, and that is something I tell my patients a lot, that our bowel is just like routine,
Yeah.
and the more we can get into a routine with our eating,
Yes.
and kind of like recognizing like, okay, when I travel, I might
Yes.
be out of routine and it just is what it is. What do I need to do to
Mhm.
help myself at least have a bowel movement every other day at minimum
It,
while I'm
right,
gone?
right.
Yeah.
And also knowing what's normal for you. Some
Yeah.
people, it may be every other day
Right.
or every 2 days, and that is just how their system works.
Hmm.
Some people have to go every day, or they'll start to have issues and start to feel it
Right.
as well.
Yeah.
Yes.
Absolutely. Absolutely. Awesome. Well, thank you so much for that. So, we talked about on the nutrition front, we talked about fiber, we talked about hydration. Those are our main things. And we didn't talk a whole lot about like regular exercise, but like even going on short little walks here and there,
Mhm.
moving around, moving your
Yes.
bowels,
Yeah.
like with yoga or just like
Yes.
going on a walk, whatever,
Mhm.
absolutely can help. But now we can kind of start talking about like, all right, I'm doing those things. What are
Mhm.
my next steps?
Right.
And this is particularly helpful if you are somebody maybe with IBS that just tends
Yes.
towards constipation, you're pregnant, or you're on like a pain medication, or some of my IVF patients who are going under anesthesia for an egg retrieval or something,
Mhm.
or on a lot of hormones that are causing constipation for them. They might be in this situation where they're doing the basics and it's time
Right.
for level two.
Right. Right.
So,
Mackenzie, wait, quick. Are you able to pull the slides back up?
oh, I thought I was
Mhm.
on the
Yeah.
sides.
No, it was, they had
Let's
went
try one more
away.
time. Mm. All right. Can you see that
There we
now?
go. Yep, got it.
Okay,
Mhm.
cool. All right. I apologize. I keep flipping through all of these.
Yeah, you're fine.
There we go. Um, so, functional foods for constipation, prunes. They're my favorite
Oh.
to recommend.
Mm-hmm.
They seem like an old lady food that only your like 80-year-old grandmother would eat, and they seem like they should be disgusting, but they're not. They're actually
Mm-hmm.
kind of tasty.
They are.
Prunes are just dried plums.
Mm-hmm.
I don't know who did prune marketing in the 90s, but they did a terrible job. And we need to rebrand prunes because they're actually very delicious.
Ah.
Um, and not only are they a good source of fiber, and that's kind of easy to get in, just being a dried fruit, they're smaller, they're more compact. It's like not as laborious as eating a whole apple or something.
Mm-hmm.
But they also contain a sugar alcohol that does a really good job of drawing water into the gut. Um, so the dose for prunes to be effective is 4 to 5. There is a difference between dried prunes and prune juice. Yes, prune juice can work, but it's a little aggressive sometimes.
Yes.
And also, many people don't like the way that prune juice tastes. So I
Mm-hmm.
always recommend getting the actual whole prunes
Mm-hmm.
from the grocery store. I love to get mine from Trader Joe's.
Mm-hmm.
They have a good deal on them. And
Prune juice also can cause a little stomach discomfort. I think.
exactly, because again, it's just a little aggressive.
Yeah.
It's because it's the juice, it's concentrating that sugar alcohol, so you're getting a higher dose in a
Got
smaller
you.
amount.
Got you.
Whereas like eating the whole prune is just a little bit gentler. So it's not going to
Got
make
you.
you have a bowel movement immediately, but
Mm-hmm.
usually the next day,
Okay.
it will help. There's also some evidence that kiwi can help us have
Yeah, I've
bowel
heard
movements
that
as well.
recently. I've heard that
Yeah,
recently.
kiwis
Mm-hmm.
contain a compound called actinidin that can
Mm-hmm.
stimulate our bowels to move. Um, and kiwi is also delicious.
Yes.
Um, and you can eat the skin of the kiwi if you don't mind how it's a little bit fuzzy.
Mm.
That will give you a little bit more fiber. But many people will just cut it in half and scoop it out with a spoon and eat it, or peel it and then chop it up. I'm a peel it and chop it up kind of girl.
Mm-hmm.
That's what I enjoy most. So that's kind of we've got our absolute basics, our checklist of are you eating enough fiber, drinking enough water, and moving. And then we can try prunes and or kiwi. If that's not working, magnesium supplementation is up next. So there are different types of magnesium, some of which can stimulate a bowel movement by, again, drawing water into the gut, and
Mm-hmm.
other types that don't do that, that are useful for other like functions like sleep or anxiety or muscle cramps or things like that. So what I recommend is magnesium citrate. And what is a safe amount to take is 400 milligrams per day in pregnancy. We need to look at what is in the prenatal vitamin already, how much
Okay.
magnesium is in there, And then we can take additional up to 400 milligrams and starting with a low dose and working your way up to see what works best for your body. That works very well. There's also Calm, the magnesium powder is, I think, magnesium carbonate, but then it has like some citrate added, so it turns into magnesium citrate in your body. And that one's an easy one. If you're worried about like getting diarrhea, you can work your way up with just little bits because it's a powder that you can mix into water, and a lot of people like how it tastes. So that's a great one. But there's also plenty. I like the pure encapsulations, magnesium citrate pills as well. And it's important to remember when we're looking for a supplement, we always want to check for third-party testing because the FDA does not regulate the supplement industry. So both Calm and the pure encapsulations that I mentioned are both third-party tested brands. There's another form of magnesium called magnesium oxide, which is commonly recommended, and that absolutely can help with constipation. There's nothing wrong with that, but we don't absorb much of it. So I like the citrate version because we do get some of the other benefits of the magnesium, like the calming aspect, the muscle relaxation, because we're absorbing some of it, and then some of it stays in the gut and helps us have a bowel movement. So that is our level 3. If we are still having a hard time, we are on to medications, over-the-counter medications and or prescription, depending on kind of what works best, what you decide with your doctor. Miralax is not habit-forming, and it's essentially, it's just like a fake fiber. There's nothing to be afraid of with it, and you can follow the directions on the package for how much to take. It's just important that you definitely drink enough water or mix it into enough water when you're taking it, and that often will help you have a bowel movement the next morning. That's kind of our like functional foods and supplements for constipation. Are there any other ones that you've heard of, Dr. Q?
No, those are it. I did hear of a concoction before when working in a nursing home. The nurses would, it was the prune juice, and they would melt like a tablespoon of butter
Oh
and
yeah.
warm it up. Oh my gosh. And they would call that the bomb. Literally. Literally. But something, well, the effects of the prune juice, like you said, and then something about the butter, I think like coating the lining of the intestines
Yeah.
or something to help. But whoa, yeah,
Yeah,
yes. I've tried it
absolutely.
once. Yeah,
Making sure
it
you're
worked.
eating enough fat overall. Like if for
Yes.
some reason you were eating a low fat diet or restricting your fat intake,
Mhm.
correcting that could absolutely help. But yeah, there's some wild things we can do out
Yeah,
there that may or may not work. That's one that can work. That's not dangerous. So please feel
yeah,
free to try
right, right, right.
butter in prune juice if you so
And
choose.
usually, like with the ones you mentioned, like I said, I will teach my patients how to do bowel massage or colon massages on themselves to
Hmm.
kind of help with some manual therapy to trying to help move those bowels
Yeah,
through the digestive system, as well as
yeah,
doing some lifts as well at the cecum and sigmoid junction area to see if
yeah.
we can get some improvement there.
Great,
And
great.
also thinking about, I'm looking at their abdominals. Like, do you have
Hmm.
tightness in your muscles? Again, the nervous system plays a part. Are you a person who's constantly tensed all the time?
Yeah.
That can also contribute to slow digestion and constipation as well because your muscles naturally aren't relaxing. So that's what I'm looking at to get to the root cause. Like we want to know like, okay, well, why are you so tensed? Or
Yep.
why is this happening a lot? Let's look at some behavioral changes that can also give us long-term results as to why you're having issues with digestion and constipation from a neuromuscular, musculoskeletal standpoint.
Yeah, absolutely, absolutely. And that's why it's important to think about both aspects when it comes to
Yes,
constipation. Is it really
definitely.
can be both
Yeah.
nutrition and pelvic floor
Yes.
function for sure. So another common factor in pregnancy and often in early postpartum too is that many people are taking iron, and
Hmm.
certain forms of iron can cause constipation.
Hmm.
So one thing that blows people's minds is that there's another form of iron that is not constipating. It does not cause digestive issues.
Hmm.
And this is the easiest fix because if you are anemic, you probably should be supplementing with iron. Yes, there are iron
Yes.
rich foods, and we
Yeah.
can use a cast iron skillet. and using a cast iron skillet and cooking can infuse our foods with iron. Those are all really great ways to make
Oh,
sure that we boost our iron
today
as
I
well.
was today years old when I learned that. Thank you.
Yeah, absolutely, especially if it's like
What's
something
the name?
acidic. Yeah. Like cooking, one of my like high iron meals that I nerd out about is super easy, like cooking ground turkey or beef with
Mhm.
some like onion, garlic, and spices and stuff in cast iron skillet, and then dumping in a jar of tomato sauce, cooking some
Mm.
pasta while I'm doing that, and then throwing some spinach into the pasta. We get vitamin C to
Love
help with
that.
the iron absorption. We're soaking in some iron from the cast iron skillet. We get actual iron from the spinach and
Hmm.
the meat, and a little bit from the pasta. And it's a great high iron meal.
Love that.
Um, so we can do all those things, and those are less likely to cause constipation and are a great way to
Mhm.
prevent iron deficiency as well if we can try
Mhm.
and add in iron-rich foods. But there's a form of iron instead of ferrous sulfate
Mhm.
or iron sulfate. There's another form called iron bisglycinate or iron chelate.
Mhm.
And this has been shown to be just as effective in increasing iron levels and correcting anemia compared to ferrous sulfate, and has no side effects.
Mhm.
It's also, I think, barely more expensive, if more, it might even be the same price sometimes compared to buying a regular iron supplement. So that is something that I'm like almost always going to switch my patients to unless they're tolerating their regular drugstore iron totally fine, or it's a prescription and they have no problems with it. Because not everybody does get constipated with that form of iron, but it is very often going to be something that I have people switch, and it works pretty much every time.
Awesome.
Okay, so collaborative care. Let's talk a little bit more. We've talked a lot about like
We have.
about this, and
Yes.
it almost seems like basically one of our big things is just making sure people know that we both exist
Yes.
to help with
Hmm.
constipation.
Hmm. Yeah. Yeah. Obviously, like you said, we talked about it. Working with a dietitian and a pelvic floor PT, you're addressing both the muscle function and dietary factors that could be contributing to your constipation. So, kind of seeing what your issues can be, or is it more of a diet issue for you? Is it more of pelvic floor function for you, or is it a combination of both? This
Hmm.
can help reduce dependency on laxatives by promoting natural, healthy bowel movements. Um, Also, increasing your education and awareness around your pelvic floor and how it functions as well. This can also help improve your postpartum healing by optimizing core strength and your gut health, right? Especially if you are a mom who is looking into breastfeeding. Those types of things as well, and how that can affect baby as well, different things. And like Mackenzie said, that I dealt with, understanding when I wasn't pregnant, I could not tolerate lactose. But being pregnant, that did not affect me as much, right?
Hmm.
So understanding how my body functions with different hormones inside of my body as well. What this essentially does is it empowers women with tools that you can use for long term, right? Digestive and pelvic health. So it helps give you a sense of understanding and education on what's happening with your body, right? We can watch all of the podcasts, we can read all the books, but a lot of times it's good to really get in to say, hey, okay, what is happening with me? What do I need?
Yeah.
What do I have a deficiency in? What are my muscles not doing properly? Where's the discoordination at there that I could work on with seeing a pelvic floor therapist and seeing a dietitian as well? So lots
Yeah.
and lots of benefits with seeing the two together, especially during pregnancy and postpartum, because so much is happening with the
Yes.
body.
Absolutely. And we're running out of time. So I want
Yes.
to encourage people that if they want practical exercises for their
Yes.
constipation and nutrition recommendations, to come see us. We've talked about a couple: the bowel
Yes.
massage, increasing your
Yes.
fruits and veggies, things like that. But I'm going
Diaphragmatic
to,
breathing, child's
yep,
pose, happy baby pose. Think relaxation. Yes.
relaxation and
And
just
Kegel,
moving
Kegling is
around.
important too. I didn't get a chance to touch that, but that would be good to get in to see with a professional to make sure you're doing it correctly as well too, to help with that
Yeah,
support and
yeah,
strength.
absolutely. So why don't you help us understand when it's important to seek professional help with constipation, when constipation becomes a medical issue?
Yes, yes, yes. So, if you're experiencing a lot of intense abdominal pain, if you're having consistent hemorrhoids or any type of rectal bleeding and you're unsure of what is going on, it's good to get in and see a pelvic floor. I'm sorry, get in and see a medical expert, whether it's a dietitian or a pelvic floor expert, to see what's going on. Or if you really just don't know, right? It doesn't even have to be an emergency type thing. It can just be that I really don't know. If you're noticing, like, okay, I'm probably not getting enough nutrients or getting a well balanced diet, right? I don't know what's safe to eat pregnancy and postpartum. I don't know how my muscles should function for bowel movements, because also thinking about, you're doing the same thing when you're pushing a baby out, right? They go hand in hand, and
Mm-hmm.
if you really just don't know, and if you had issues over time, and also too thinking back to your childhood. Did you have issues in your childhood
Mm-hmm.
with certain issues with constipation, not wanting to go, having a hard time, having some leakage, excessive wiping? All of those things can kind of indicate, okay, I probably need some professional help, right?
Yeah, absolutely. And even some of the like the bleeding and the hemorrhoids and
Yes.
things like that, getting checked out by a medical professional,
Medical
like a
doctor. Yes.
doctor, nurse
Definitely.
practitioner, PA,
Yes. Yes.
first is also going to be important just to make sure
Yes.
there's not something more serious that's
Right.
beyond our scope of practice. And
Right.
we're probably going to send you back to
Yeah.
them if you
Yeah.
haven't gotten checked out yet.
I'm
Um,
definitely sending you.
yeah, right. Um, and if you are going like to like pushing on a week of not having a
Yes.
bowel movement, it's time to go seek urgent
Yes,
care,
definitely.
or something like that.
Nausea, feeling, vomiting, any types of things. Yeah, intense pain to where you can't get comfortable or can't fall asleep. Those types of things is like, okay, this is probably more of a medical emergency, and I
Yeah,
want to look to see what could be going on. Make sure you don't have any type of small bowel obstruction or anything going on.
yeah, absolutely. But even on like when to see us, when to see your
Yes,
dietitian or your pelvic floor
yes.
PT, like Quana was saying, if you're just curious,
Mhm.
you can see us.
Yeah.
That's absolutely fine, and we would love to support you at any point in your journey.
Mm-hmm.
Even if we're still going to probably send you to the doctor
Yes.
first, come
Depending,
back.
yes, definitely.
We just need, there's just some other
Yeah, we
stuff
have
that
to
we need
rule
to
out
do.
red flags first and
Yeah,
make sure everything is
exactly.
good.
Exactly. Exactly. Um, okay, so I am going to see if our Q&A even is a thing and happening.
Okay.
I have a feeling that it's not.
Okay.
Unclear. And let's see here. I think that let me just check one thing really quick. Um, but I think often some of my, let's see here, message everyone, chat, studio chat. Yeah, apologize for anybody watching this live. Um, we're new to this. If you can't tell, I'm trying to figure this out. But yeah, it looks like our chat function either isn't working or we don't have any questions, which is totally fine. Again, at the beginning, like we were saying, if you do have questions, we're both on social media. We'd absolutely love to engage with you guys and talk more about this, answer general questions. But I'm going to pull up our kind of ways to work with us slide
Oh,
really
yes,
quick.
definitely.
Uh, sorry, we lost our screen share function. All right. So, like I said, it features us nutrition and wellness. We're a nutrition counseling practice. I am the founder, but I do have two associate dietitians, Kristen and Natalie, who are fantastic as well. You can apply to work with us at our website, which is www.feedyourzest.com. We're a virtual nutrition practice, so we see you where you are. We're licensed in a lot of states across the country. Licensure laws for dietitians do vary, so we can't see everybody all the time, but we have a great, we've got a lot of referrals if we can't see you. And as far as payment goes, we accept private pay, Blue Cross Blue Shield, and Aetna insurance. A lot of people have nutrition counseling benefits that they don't know about, and many people can see a dietitian completely free with unlimited visits or a lot of visits at least. So we do accept that, and then we do of course accept private pay and do packages as well. and we would love to work with you. How can we work with you, Dr. Q?
Yes, yes, yes. So I am located in Charlotte, North Carolina. As it states on the slide, I'm in the Elizabeth neighborhood, so I'm right beside Novant Health Presbyterian Hospital. I can also treat virtually as long as you live in the state of North Carolina. I can do telehealth appointments as well. You can go to www.ptforher.com to schedule an appointment. Actually, you'll complete the consult form, and then my front desk, Monica, will get back to you, or you can call the office directly at 704-309-5520. You can reach out to me on Instagram at PT for Her if you have any questions, or just to check out, get my vibe. I have some funny reels on there. At least I think are funny.
They're hilarious. I love your reels.
Yeah, I need to get back to it. That's a full-time job in itself. Um, but I am considered an out-of-network provider, so what that means is that the fee for service is due at the time of the appointment. I do accept HSA and FSA as a form of payment, and I do give my patients super bills to submit to your insurance company for reimbursement. I also accept care credit as well as a form of
Okay,
payment.
great. Care credit's good to know. Awesome.
Mhm.
Yeah, and some people are nervous about going private pay route for pelvic floor therapy. Honestly, in the Charlotte area, our like access to insurance covered pelvic floor PT is just kind of hard.
Yeah,
But
it's
a lot of people
hard.
do have out of network coverage for physical
Yes,
therapy that they
definitely.
don't
Yeah,
know
a lot of
about. So
people have out of network coverage that you don't even know that you have
yeah,
as well too. So, thinking more so quality of care,
yeah,
those types of getting in sooner, those types of
exactly.
things. So really just weigh your options, weigh your pros and cons, and you definitely want to go with the fit that's best for you.
Yes,
Definitely.
absolutely, absolutely. Well, awesome. Thank you so much, Quana, for joining me on here. This
No
was so fun to
problem.
chat with you. And again, unclear if we're actually
Live
live
or not?
or not right now,
We were live with each
but
other.
we are recording. I know that. And so this will be posted shortly. And oh wait, look, there's somebody in. It looks like we're getting a chat. I just can't see um, the actual like messages. I get like a what the heck? Do you see that
I
chat
did
on the
see
side?
that. Yeah, I did.
Yeah, but I don't know where it is.
It's lost in space.
It's lost in space. I'm so sorry, people. Thank you
If we
for.
find it, we will, depending on we will answer that
We'll
question.
try to answer these questions
Yeah.
after the fact. We have people who signed up. We have your emails, and so
Yes, we do.
if it's a simple question, we'll shoot you an email. Well,
Mhm.
thank you so much, Dr. Q. I hope you
Thank
have a
you.
great rest of your day and
You
a great
too.
weekend.
Thank you. Thank you.
Bye.
Bye.